10 surgeries scheduled to be admitted to my unit. How many nurses do I have? 1, 2, 3, 4, 5. 5 nurses, 10 admits, plus the 20 patients already on the unit. The staffing ratio should be 1 nurse to 4 patients, 5 max. Now I have to figure out who to call. Wish we had computerized staffing. It would be so much easier to look people up online and see who could come in without overtime.
Good morning. I was just walking by. Are you okay in here?
Good morning, Dr. Biscotti. I'm just a little frustrated, that's all. The unit's short-staffed again today, and I have to flip through this binder to figure out who's available to come in.
You know, some of the other hospitals have computerized programs that track staffing in real time. It's supposed to cut down on paper schedules, and it allows the employees to sign up for days that they're able to work.
Well, that's a great idea. I bet we should bring this idea up at the Friday meeting. Maybe the time that we save from filling out these paper schedules will make the price worth it.
I agree. Well, you have a good morning.
Good morning, doctor. Good morning. Can I speak to phone nurse?
Hello?
Yes, would you be willing to come in today? We're a little short-staffed, and we could really use the help.
Am I scheduled to come in? I didn't see my name on the schedule for today.
No, you're not scheduled. I'm just asking if you wouldn't mind volunteering to come in on your off day.
Oh, I'd rather not. You should call her in. She always comes in. She loves the overtime.
Well, the evidence shows that more overtime hours are associated with an increase in urinary tract infections, shock, GI bleeds, and extended length of stay. So I called you first to try and prevent the overtime. But thanks for the suggestion. I hope you have a good day. Hello, RN. We're short-staffed today. Would you mind coming in to help out?
What happened? Is someone absent?
No, no one's absent. We simply didn't anticipate needing 7 nurses today. Since the schedules are posted 4 to 6 weeks in advance, our nursing need forecasts are often wrong. There's 10 surgeries today, and 5 of those were unexpected.
Oh, okay. I'll come in and help the team out.
Thank you.
Oh dear. Let's see what we have to do today.
I've got 5 patients today. We must be short-staffed. Who's missing?
I don't know, but today is my 5th day in a row. I got called in this morning. I just want to get through the day with no problems. I need coffee.
I don't know why the nurses are complaining. We get 8 patients regularly, and we end up doing all the care.
I know, right? To think I was going to nursing school, changing my major, and I'm definitely getting another job.
3 of these patients are totally new. I know nothing about them, and 2 are high acuity patients. Mr. Burns has 17 meds to be administered at different times. Look at all these doctors I have to consult to. And Mrs. Winehouse has a trach, a peg, 2 stage 4 wounds, and some cardiac problems.
Don't worry about it and get out.
Sometimes, yeah, it's fun. It's good idea.
Well, good morning, everyone. Today is Jennifer. Came to help out today. It's her 5th day in a row, and still she came in to help out the team.
Poor RN. There's no way I could do 5 days in a row. That shouldn't even be allowed. Couldn't we have called in a few nurse techs? I mean, they're supposed to do everything an RN does except pass meds.
Time spent on direct patient care is associated with a decreased risk of death in the hospital and a shorter length of stay.
The families have been complaining that they don't see enough of me. But when we're short-staffed, I have 5 patients, and 2 of them are high acuity. It's hard to make my rounds. Nurses are supposed to practice patient-centered care. It would be nice if I could spend more time at the bedside.
You know, more staffing overall would help. Pain could be assessed more frequently, patients could be toileted regularly, Q2-hour turns can actually happen every 2 hours instead of when time permits. And we would even have time to reposition the patients, and that way they're not jumping out of the bed because they're uncomfortable. That would be wonderful.
If we had more staff, no one would have to work 5 days in a row. 5 days will burn you out. Doesn't burnout lead to decreased work performance and difficulty retaining staff?
Yes, LPN, it does, and that brings me to my next point on the agenda. There is a meeting this Friday at 9 o'clock. A hospital administrator at each table, and he or she will be available to listen to your ideas.
Wow.
Sounds
A
good.
lot of other places are offering loan forgiveness programs and internships. If we had that, I'd stick around.
Me too.
It'd be nice if there was room for job advancement. I mean, I'd like to be an RN and develop care plans and maybe be charge nurse someday.
Well, those all sound like good suggestions to bring to the meeting on Friday. I encourage everyone to attend so things can finally start looking up. Now, to conclude this staff meeting, I'd like to let you all know how much I appreciate you. Remember, the patient is the center of all we do, so stay positive. Let's hit the floor running and have a great day.